Today, I want to talk to you about a new parameter to measure spasticity that we developed here in Iceland. We have a team of researchers, both at the rehabilitation department at the University Hospital and at the Health Technology Center here at Reykjavík University. So to start with, I want to make sure that we're all on the same page regarding spasticity. Spasticity is a neurological damage that is present in patients with diseases such as stroke, CP, spinal cord injury, and MS. And in 1980, Lanz proposed a definition of spasticity that is still to this day the most commonly used one. And his definition says that spasticity is a motor disorder characterized by a velocity-dependent increase in tonic stretch reflexes with exaggerated tendon jerks resulting from hyperexcitability of the stretch reflex as one component of the upper motor neuron syndrome. So what Lanz is telling us is that spasticity is characterized by the hyperexcitability of the stretch reflex. And this is actually thought to be due to a lack of inhibition of the stretch reflex. But there's also some non-neurogenic resistance that is present in spasticity. And this resistance can be changes in muscle fiber sizes and length, and also changes in the distribution of muscle fibers. So this fact makes it a bit challenging to measure spasticity because we have both neurogenic components that are composed of the stretch reflex mechanisms, and then we also have non-neurogenic components. And another fact that makes it challenging to measure spasticity is that it is time and context dependent. So you can have an individual with spasticity and two measurements can yield completely different results based on, for example, the time of day or the emotional state of the subject. So this can be very challenging, but we still have some great research on methods to measure spasticity, and there have a lot of methods been proposed. And these can roughly be classified into clinical scales, biomechanical methods, imaging techniques, and neurophysiological methods. And I actually want to give you a better insight into one biomechanical method that we use for our parameter, and that is the Wartenberg pendulum test. So the pendulum test was introduced in the 1950s to measure spasticity, and it has been proven to be sensitive to spasticity. And the test is based on letting the lower leg swing freely under the influence of gravity and measuring the knee joint kinematics. So this is a biomechanical method because it looks at the oscillatory resistance of the knee joint. And often a goniometer is used to quantify the joint angle. And various parameters have been derived from this test. But what we actually did to compose our parameter that we call the reflex period is that we used simultaneous EMG recordings while we performed the pendulum test. So we combined both the biomechanical features of the pendulum test and the neurophysiological features of having an EMG recording. So we had data from two separate studies. We had 4 subjects that suffered from stroke and 4 subjects that suffered from spinal cord injury. And all of those subjects had spasticity. So what we did is we performed the pendulum test with a simultaneous EMG recording. And then we found the time where 50% of the maximum velocity of the first excursion of the swing was. And we measured the time until the muscle onset that we could detect from the EMG recordings. So if we look at the a bit more visually, we can see it here. So on the top, we have the position curve for the knee ankle. And we actually differentiated that curve and found the maximum velocity. So you can see here that we have our first event, or first time mark. And then we took the EMG recording and we found the muscle activity. And the time between those two events, we called the reflex periods, and we used to quantify spasticity. Now, in this study, we determined the muscle activity visually, which can be a bit challenging, but to make that easier, we processed the EMG data in a way you can see right here. First off, we filtered it with some notch filtered and low pass filters and high pass filters from 10 to 400 hertz. And then we squared it, and then we used a Gaussian filter to smooth it. So you can see that this makes the muscle activity onset a bit clearer. Now, on to the results. Here we can see a box plots that depict the results. We have the reflex period on the y-axis measured in milliseconds. And then we have the spinal cord injury results and the stroke results. And the average reflex period we got for the stroke patients was about 215 milliseconds, whereas the average reflex period we got for the spinal cord injury patients was around 370 milliseconds. So what we can see from this is that we had a smaller reflex period for the stroke subjects, which actually indicates more spasticity. Now, why could this be? We thought of it in a way that the reflex period might reflect the time that passes during the stretch reflex pathway. So the fact that the reflex period is shorter in stroke patients might indicate that there are some inhibitory mechanisms that are missing from the brain, that the brain is not sending. And in spinal cord injury patients, it could be that those inhibitory mechanisms are just getting caught on the way. And with the reflex periods, we managed to combine neurophysiological and biomechanical features of spasticity and hopefully create a valid and sensitive way to measure spasticity. But we need to test a bigger cohort to be able to prove the validity of our parameter. And also in our next steps, we could improve the parameter by, for example, using muscle onset detection algorithms to detect the muscle onset instead of doing it visually. So that might lead to a higher accuracy. And we can also enhance our measurement methods, for example, by using needle electrodes, which we're planning to do shortly. And this study was done with a very small cohort of only 8 subjects, and we hope to be able to include more subjects in the future. So that is all for me today. Thank you for your attention. And if you have any questions or tips, please share.
Thank you very much, Kristjana, for this nice presentation. It's always good to have new approaches and new ways to do measures. I wonder if there are any questions in the audience.
I have a comment. I congratulate Kristjana to a clear, short, effective, time-saving presentation.
Thank you, Hugo.
Toddur is a good teacher.
He is. That is true.